So after needs assessment, setting objectives, put on your apron and wash your hands. When you are putting on the apron, you should be mindful that the outer part doesn't touch your uniform. So you wear it neatly, tie it behind you. Then you go and wash your hands as such. You put the bottle already has a hole at the top. So you put the bottle in your armpits. You don't open the cover. And then you use your soap and wash your hands accordingly. Then dry your hands as well. Then you come and pick all the items you need for the particular activity. It depends on the activity. Sometimes the activity is weighing, vital signs, sometimes wound dressing. So you is wound dressing, you should know where your sterile items are. And please always we pick from the outer compartment. So the tray is always at the outer compartment before you go to the middle and the inner where it is sterile. You pick the items you need and you come and do the activity accordingly. If you have to weigh a client, especially adults, you have to finish checking vital signs, especially the BP, before you come and weigh the client. In situations where you are doing care plan, like diploma students, then you will need the temperature of the client. If you don't need, you are not using a care plan, and client is not one to touch and not complaining of fever. To me, I don't think you have to check the temperature, but the BP you have to check because you use it to cancel the clients. There are people who are hypertensive, they are not even aware. Yes. So you do the activities accordingly, according to the needs of the client. So after everything, you explain to them your findings. Please give them the right information. The findings, tell them your BP is 120/80, and that is okay for your age. For your age, if you were above 130, the top one is above 130 and the down one is above 80, then there will be a need for concern. Or the top one is below 90 and the down one is below 50. But because you are within, tell them which ones are the normal range and which one is the abnormal, so that they will appreciate what you mean by it is normal. Okay. Yes, and don't forget the objectives you are setting, you are supposed to identify about three of them, at least three, and solve them with the client. Now you're coming to educate the client. Please, when you are counseling the clients, make sure you are seated. It looks like some students will stand and counsel clients. Counseling is not done like that. The environment should be friendly and welcoming before clients will be able to feel okay to talk to you about his or her issues and even accept the solutions you are discussing with him or her. So education is the last thing that you will do. You educate clients on prevailing health issues. Prevailing health issues can be clients' own prevailing health issues or prevailing health issues in the neighborhood, in the community, in the world. It can be that this community, typhoid is very common. So you talk to clients about typhoid after you have done the personal counseling with the client, or about malaria, or if it's worldwide, COVID-19, HIV/AIDS. Yes, so that is how you educate clients about prevailing health issues. Inform them about your next visit. Okay. And then, yes, you thank them, you pack your items. Please, all used items should be packed well so that when you get to your hostel or the hospital, you can clean them again in the fall. next use. Yes, and don't forget, the objectives you are setting, you are supposed to identify about three of them, at least three, and solve them. Hope this helps. Thank you.